Hi, this is Sarah. This is just a space where we're going to slow down and talk through the things that I am seeing and hearing and still trying to make sense of, all while we're in the middle of the work. Sometimes this is just going to be me thinking out loud, and sometimes we're going to have a conversation with other people. Either way, it's not polished, it's just real. So, let's talk about it. Welcome back. Today's conversation sits right at the intersection of clinical decision making, operational performance, and cost. We talk a lot about pressure in healthcare, but not always about how the decisions are actually made inside the system. And that's where value analysis comes in. I'm joined today by Dr. Hudson Garrett Jr., Executive Director of the Association for Healthcare Value Analysis Professionals. He's going to talk about what value analysis really means, where it's evolving, and why the partnership with ALM matters right now. So, with that, welcome, Dr. Garrett. We're glad to have you.
Thanks so much, Sarah. I appreciate the invitation.
You're welcome. And I know that you are on vacation today, so we appreciate you taking the time to step away and be with us. And I hope that you can get out of here and get back to the beach and to the pool, having a good time shortly after we finish. But with that said, I just thought I would give you the opportunity to just talk a little bit about yourself, a little bit about your background, and your role with the Association for Healthcare Value Analysis Professionals.
Sure. I've had a very interesting career. I currently am the executive director and executive vice president for AVAP. AVAP stands for the Association of Healthcare Value Analysis Professionals. And much like ALM, I think, in the introduction you referenced, we sort of hit it off when we met. ALM and AVAP share the same synergy, right, towards improving patient care, improving safety, and in making sure the outcome is as positive as possible for our patients. Personally, I come from a clinical background as a family nurse practitioner with a specialty in infectious disease. I've worked on the industry side, I've worked on the hospital side, and now obviously work with the nonprofits as well. And I'm also an adjunct assistant professor of medicine in infectious diseases at the University of Louisville School of Medicine. So the thing that I personally love is bringing connection points to solve complex issues in healthcare. I know when you and I recently spent time at ARN together with Liz, you could feel the energy in the room and all of the passion that we have together, right, to solve some of these very unique, very cross-functional challenges that we face in healthcare. What I'm particularly excited about with our new partnership with ALM is that synergy that we're shared. It's almost like when you think about that Olympic torch and you see those athletes running down together, and they may come from different backgrounds, perspectives, and lenses, and so does AVAP and ALM. But what's unique is that torch is putting that patient first, putting the caregiver first, and frankly, being able to serve our communities that we have such an ethical responsibility to take care of. And I think that's something that both of our organizations share that unique love and passion for.
I couldn't agree more. And we've even talked about the fact that it's not often that you find associations that are very like-minded and that really want to work together for the betterment of the patients. Sometimes for us, it's within our own industry, but it's very refreshing. And I realize, and so do you, that we can accomplish so much more by working together. We don't have to reinvent the wheel, and we can also create that synergy faster by pulling our forces together. And it's been so much fun. We did have a good time at AORN. I will say, when we saw you, I wasn't with Liz. I was actually with Dave Fox from Standard Textile. I hope a lot of my viewers know who Dave is. But I was taking Dave over to introduce him to you, and you were working in a booth and you were doing a Jeopardy game on infection prevention. Now, granted, we were with a bunch of nurses. So that may be the one caveat, but the fact that it doesn't matter who they are, you still had probably about 20-25 people extremely engaged and excited and even laughing and smiling when you were talking about infection prevention. That is a skill set that I don't think everybody has. It was really unique to watch, and just the your ability to create so much energy and synergy within that group. So I just wanted to throw that out there because not a lot of people have the ability to get people excited about infection prevention.
Often when I'm speaking across the country, I'll hear someone mumbling in the back of the room before they know I'm the speaker, and they'll say, "Oh gosh, here comes another boring infection control speaker." And I really take a lot of pride in that, to your point, because whether it's linens or dietary or environmental services, or even in many instances value analysis, people have this misconception that it is this one particular box. And I think that's what's great about value analysis is that it's a conduit. It's almost like an octopus. How do we ensure the patient's receiving the right level of care? We're bridging evidence-based care at the bedside. We're doing it for the most cost-effective means possible. We're meeting the needs of our clinicians, and we're doing it in the most safe, efficacious, and least painful manner. I think is a really exciting point for value analysis to serve in healthcare. And ALM is just our newest tentacle of the octopus, right? As we look at how do we improve healthcare from the inside. And I know you and I have both worked inside a healthcare facility, and now we're in these roles. And I feel like what we owe to every healthcare practitioner is their best chance for success. And so much of healthcare is, quite frankly, fighting against failure. And sometimes fighting against failure even internally. So how do we make sure that the patient wins, the caregiver wins, and the community can receive exceptional healthcare regardless of where they live? And as something as simple as high quality linens that are clean and sanitary, that makes a big difference, right? For not just the HCAP score and the metrics that we really measure, but more importantly, for the patient to feel like their care is world class, right? Nobody goes to the hospital and says, "I'm here for average healthcare. Please check me in." They always say, "No, I'm here for perfect, exceptional care, whether it's a small ambulatory elective surgery or an emergency appendectomy, or frankly a long ICU stay where the family's looking at that bed linen and saying." When's the last time that was changed? Or they look at the nurse and say, "When's the last time my loved one actually received a bath?" And sometimes it's good to just go back to the basics of human care, to look at the caregivers and say, "What do you need to succeed?" And then for us as leaders to say, "How do we execute upon our promise, right, to help our caregivers win?" We need the patient to win and the caregivers to win.
Everything that you say just makes me like want to clap my hands and jump up and down. And I know I'm not alone, so I'm excited for our listeners to hear what it is that you have to say. But that said, let's back up just a minute because we have a lot of different people that are going to be in the audience here, and we want to make sure that we bring them along with us. So let's start at the very basics. For those who aren't familiar, can you just talk a little bit about what value analysis is and the role that it plays in healthcare today?
Absolutely. And if you were to ask me the question 5 years ago, right, my answer would be slightly different, and it continues to evolve. I describe value analysis as almost like this octopus that exists in this very large ecosystem. Many of our members from AVAP do come from a clinical background, but we've also got some very, very talented members that come from more operational or business backgrounds. So, value analysis is this unique hub. Think about it like a wheel on a bike, and all of the different spokes represent different perspectives that they have to bring to the table. Certainly foremost is patient safety. We want to make sure that it's applications of evidence-based practice, that we're looking at things in terms of implementation. I like to call it the pain score. How painful will it be for me to implement this technology? I think one of the big things that we're pushing, especially on our end, is what is the why behind this? Is this truly solving a root cause issue? Or is this just adding another level of unnecessary complexity to the equation? What is the problem clinically that we're trying to solve? If we can't answer that question, then we have bigger problems, right, that we need to explore. And there is, we don't want to hide this. There is a cost perspective to this too. Healthcare is a business that must have, money in order to deliver and invest in the service. And so if healthcare is always broke, well, then we don't have the ability to get the latest MRI, or the latest CT, or build a proton center. So it's in no way saying that we're not looking at cost, but from a value analysis perspective, what we look at is, can we get the right product for the right need for the right patient for the lowest possible cost available in the market? Now, what that means for the clinicians is that, let's say, Sarah, you're the bedside nurse and you're thinking, "Oh gosh, here comes value analysis. They're going to take away my premium product." That's not our intention. Our intention is to make sure we find the most clinically appropriate product for the task that you're looking for, right? Based on your input as the expert clinicians at the bedside for that lowest possible cost. And any cost savings that we accrue there can then be leveraged elsewhere. Now, that all being said, I heard years ago a very interesting statistic that if we eliminated all healthcare supply spend, right, we just got rid of it, we would still be broke. And the reason is, of course, our largest line item is FTEs. And out of the FTEs, the largest line item is nursing. So very much one of our perspectives from a value analysis, arena is how do we help caregivers be their most efficient, be the most safe, right? Deliver the most evidence-based care. And a lot of that looks at innovation, but the innovation is not just in product. And I think that's a big misnomer. The industry community may say, well, you need my product. Well, that's the difference between a vendor and an industry partner, right? An industry partner is going to say, Sarah, tell me about your challenges that you're facing here. And they very well may come back after hearing and listening to that conversation and say, what I'm hearing is you don't need a product, you need better support for this process, or you need to improve competency with these individuals. And so it doesn't always lead the trail back to implementing a new product. And I think that's a harder conversation sometimes, right? And often we probably need to do more of that and say, how do we fix the personnel, right? Give them the right level of competency, the skill set, the training, the autonomy to perform the role. And then how do we build highly reliable, safe processes? And that's that principles of HRO, high reliability organizations that all of us want, right? I mean, as a consumer of healthcare, you and I both want to go to the hospital and say, I want to come out alive. I want to come out well. I want to receive exceptional level care. And so I think that's where value analysis can play a unique role, and also partnering with great organizations and professionals like yours. And that's why we're extremely excited to be working closely with you.
Yes, I couldn't agree more on everything that you just said. And I'm excited to bring textiles to the value analysis conversation because that's not always the first category that people think of when they think of value analysis, but they touch almost every patient. How should organizations be thinking about textiles through a value analysis lens?
It depends on what we're looking at. And I think the very first thing to your question is to start with it as an overall category, right? We are so great. I call it the dartboard in healthcare. You've got a dartboard in your office, and today's problem is this. And you throw the dart and you try to hit it. And sometimes we hit and sometimes we miss. But what we need to do more of is strategic level enterprise thinking. So we say, okay, let's look at linens as a category. Let's look at environmental services as a category. Let's look at dietary as a category. Let's look at nursing items as a category. And that allows us to have bigger, more effective wins, and also really not negatively impact change management, right? Because, if you go on a nursing unit, especially, and you say, I'm here for value analysis with the change, nurses are not very happy with that. But if you say, we have an enterprise level, initiative that was based on your feedback with your input, tested by you, here's your colleagues that provided that, and we are really excited to be able to deliver upon something that you asked for, you're going to win. And I don't think it's any different with textiles. The folks that interact with textiles the most, right, on the clinical units are the nurses, the nurse techs, potentially environmental services. Are we involving, right, all the different stakeholders in that linen management process? Here's another thing, and I'm going to throw myself under the bus. I knew a lot about linen management in terms of infection prevention and control, right? Because that's my world. But until I met you and ALM, and thanks to your generous, donation of getting me access to the certification programs, I didn't know anything. I thought I knew some stuff, but I didn't know anything that was relevant to looking at the broader picture. And I think we need people to have that attitude to say, yes, you may know some pieces. You may know, this over here or that over there, and that's great. Bring that perspective to the table. But without holistic level engagement, whether it's, directly as a member of ALM, directly as a member of AVAP, but also engaging and going to the table and saying, give me, give me, give me. I want as much knowledge, education, competency, exposure, case studies, whatever it is that I can get my little paws on, then we don't fully come to the table as a partner. And I had committed to you before I met you in person that I was going to finish those two ALM certifications. And as you are aware, I stayed up till midnight the night before to make sure I met that. That was important to me, because I don't think we have many people, whether it's infection preventionist or patient safety or other disciplines, that necessarily will do that, and we have to change that. And it's not about chasing a certification; it's about chasing knowledge that allows us to be better collaborative partners to solve these complex issues.
And you've proven that over and over again. The credentials behind your name actually justify that for you. I think you have more certifications and credentials than anybody that I have ever met, which is almost kind of intimidating. And then until you actually get to talk to you in person and you realize that, you know, you are very down to earth. And I love that about you. For the record, I will just tell everyone that the two certifications he was talking about is the CLT. It's the certificate for linen technician. It's the frontline linen training program that we have for frontline personnel inside linen distribution and linen management in the hospital. And then the MHLM, which is the mastery for healthcare linen management. And that is the big certification that we have that focuses on all things healthcare linen management. And just very quickly, Dr. Garrett, I will ask you about that exam because I know that one made you that one made you nervous a little bit.
I thought it was a great program, and I'm a tough critic. You know, I'm somebody who writes exams for a living, right? Both as a professor and also as a credentialing officer for a nonprofit. So I write tough questions. I thought it was an exceptional training program with a great assessment of knowledge. But here's what's I think most cool is I have told about 50 different people in all different settings, including the airport on the way home, about ALM and about that credential. And people said, "Well, why did you do that? You know, was it to get something else after your name?" And here's the truth: is I don't care what's after my name after the BS, because the bachelor degree to me was the one that I feel like was the most difficult, right? Because it's that initial degree, and for so many that is their initial stamp, right, of commitment to ongoing education and achievement, and to quite frankly perseverance. And I don't pursue certifications without a plan. I know a lot of people say, well, really? And I'm thinking, no, absolutely true. Every single credential that I have pursued is intentional.
Mhm.
For example, risk management. Somebody may say, well, why in the world did you become a healthcare risk manager certified? Because I quite frankly got frustrated with some risk management personnel that I dealt with because they did not see me as a peer. I wasn't invited to the conversation, and I thought, well, I'll fix this. I'll just go get the certification. So I went, got the training, attended multiple conferences, got some exposure, actually did a rotation, and then sat for the certification and passed it. And guess what? Those same very people have said, oh, well, let's invite him, right? So
Mhm.
sometimes it is about changing perspective, whether it's real or perceived. And I find that when you get a group of people in a room that actually want to solve problems, the brain trust and quite frankly the energy is palpable in the air. And we certainly felt that after spending, you know, several days with you and Liz at ARN. And I think that's the other thing too, is how do we bring the right partners to the table where they're not today? You know, ALM was not at the table with ARN. And the very first time you and I talked, I said, we got to fix that, right? We have got to get ALM having a representative seat, right, as a subject matter expert with the Guidelines Advisory Board. And we fixed that. And, you know, we want to deliver to ALM, you know, things that we can deliver because at the end of the day, the patient, which is our loved ones, and frankly, quite frankly, us too, we win. And it's all about making sure the patient gets a world class, exceptional level of safe care. That's value analysis. That's EVS. That's linen services. That's all of us. The problem is we have never historically functioned at the same dinner table. And I think Sarah, you and I share the passion that that's got to change.
It does, yes. And thank you very much for helping to get us plugged into AORN. That is definitely a seat that we have not had before, and we're really excited for that opportunity as well because it is nice to have that seat at the table, and it can make all the difference in the world for us moving forward as an industry. Um, also, um, I liked the point that you made about why you go after these certifications, because I think that sometimes that's something that we don't think about. We don't think about the fact that us putting ourselves in the shoes and giving us the same knowledge, the same background, the same credentials, right, can actually level the playing field and solidify that seat at the table, or even get us invited to tables where we haven't been before. So thank you for bringing that out like that. I really like that and appreciated it. So we're almost out of time, and I don't want to keep you from the beach. So let me just ask you this. So let's kind of talk about it from a laundry operator's
Mhm.
perspective. We've talked a lot about the laundry contracts, especially. I know that's one thing specifically that we have talked about doing some work around, specifically because we need to make sure that all the right people are at the table. And in the laundry industry, that's often what I hear in conversations is, oh my gosh, we've got to make sure that the right people are at the table from the very beginning. And then, have some accountability and responsibility for that contract, rather than what's done today, which is sometimes, very broken and convoluted. So, with that said, if you could give one piece of advice to laundry operators that are trying to better align with value analysis and their hospital customers, what would that be?
I think first and foremost is build a spirit of collaboration, just like what you and I have. I mean, you and I are frequently texting at midnight because it's not because we can't or want sleep. It's more that we have so much more to get done. And I think that's exciting. I don't want to work in a world where we're bored and we don't have things to do. That all being said, we are still fighting against adverse events that are preventable, right? Nobody wants a preventable adverse event. And so, unless that day arrives, which sadly I don't see is happening anytime soon, where we wake up and the news is saying there's zero preventable adverse events, we're not done. And so I would think about it that even with your title, like look at infection prevention and control. Which one do you want to be? If you're controlling the infection, then you're probably behind the eight ball. If you're preventing the infection, are you doing it proactively? Are you out in the units? Or are you sitting behind your desk? I think the same is true with value analysis and linen management. The term linen management to me can be a little bit sterile, just like infection prevention, but it's really more about patient experience, patient satisfaction, clinical quality and safety, ensuring that patient, healthcare associated infections can be prevented. So I would almost say we've got to transform the way we even articulate what we do today. So your title may be, senior director of linen management or enterprise, vice president of linen management. What does that mean? The same is true with value analysis. And as I mentioned earlier, value analysis is all these different spokes on a wheel. I think linen management is the exact same thing. It is a critical, right? No different than central sterile processing or EVS or dietary. These are critical functions, and we have to treat them as such. Now, that comes with the level of reverence, right? That when we are talking to a linen services manager or even a washroom technician, which is the certification that I'm working on now, on vacation, by the way, I think you have to treat it with the reverence that's necessary. That at the end of that equation, it doesn't matter how many pluses and minuses there are on the left, on the right, the same thing is always on the right side of the equal sign, and that's the patient. And if we could transform the way that we talk about the work we do, the work that we do physically, our process management, our reliability, our safety, so that the patient, who many times we don't even meet, knows that that safety system is present and that there's pride in that work, then I think we all win. And that's a big ask, right? This is not a small lift, and it requires all of us. It requires pure accountability. But I don't see linen services as linen services. I see them as a conduit to improvement of patient safety, reduction of harm, making sure that when my dad was in the hospital, he had a high quality linen that made him feel comfortable, right? That it felt more like his home, because my dad was terrified when he had surgery and he sadly had an adverse event. And I look back and think how many millions of patients have that same experience every year that we don't even know about. So something as simple as a pillowcase, or for me, I have to have high quality pillows. I'm not going to lie, I'm a snob about pillows. When I go to the hotel and they have foam pillows, I almost have a small heart attack, and I have to call and say, do you have, I need the feather pillows that are a little bit, fluffy, but not too fluffy, right? So we all have our needs. That's okay. But our patients also have those needs, and linen services, infection control, value analysis, we all have a role, right, to improve patient safety, to improve quality, and to make sure the outcome is exactly what the patient wants. At the end of the day, it's not up to what you and I think about patient safety or quality. It's what the patient defines. And I've talked to a lot of patients. They all want perfect health care. They don't want an adverse event. They don't want a wrong site surgery. They don't want the wrong drug administered. And they frankly don't want scratchy linens, right? So, how do we work together to make sure that our patients have the highest quality stay in our institutions, that they know that we're preventing harm, and they also know the steps that we're taking to ensure their comfort, because at the end of the day, the patient in the bed is a person. They're someone's loved ones, and it's a privilege to take care of them. And I get emotional when I talk about that because I think sometimes we lose that. But it's not a right to take care of a patient; it's a privilege, and we have to treat it with everything that's around them in that ecosystem. Whether it's the food, right? Nobody wants crappy hospital food. I don't want crappy linens. I want really good linens that are going to be of the highest quality. But we also have to work with our industry partners and say, how can we do so for the lowest possible cost, manage the linen supply, and also, frankly, root out waste? I know that's one of the things that we're going to be working on with you specifically is how do we come together to foster waste reduction so that we can take that reduced spend and then reinvest it right into the healthcare system so that we have better resources for our patients. So that's where my head is at. And it sounds grandiose, and it is on purpose because I think if you don't dream big, you can never achieve big. And that's where the beauty of AVAP, AOM, and our two members coming together can really solve some complex challenges.
I couldn't agree more. And I also, I not only am I excited to elevate textiles in the healthcare space and the conversation that is around those, but also I think a lot of the message that you just shared is really important for all of our employees that are inside our plants. A lot of times they're not there even. Most of the time they don't even work for a hospital, right? They work for a commercial laundry third party that happens to process healthcare textiles. And sometimes they can feel a little removed from the work. And we always try to work to strive to get them to understand the significance of their role. Like, yes, you may think that you are just washing sheets or you're just, putting towels through a small piece folder, but in reality, what you are doing is you're creating a patient experience at the end of the day, or a customer experience. In hospitality, it's not even just specific to healthcare, but for me, with healthcare specifically, you think about your loved ones that have been in that situation where they're in the hospital. Sometimes it can be a sad situation where they're having to go through surgery or they, maybe had a heart attack. Sometimes it's enjoyable when you go to the hospital to have a baby. But at the end of the day, like the work that you are doing is actually really a part of their care that they receive when they are at that hospital. So I appreciate you bringing light to that because I think it's going to be music to the ears of a lot of our listeners.
Well, you brought up a great point because when I talk to nurses, they get very, we'll just call it territorial when they hear that many instances, environmental services spends more time in the room interacting with the patient than the nurse does. And that's not an indictment at all of nursing. It's an indictment of the systems, right? The documentation, everything that's required of a registered professional nurse right now. So in no way I'm saying that it's the nurse's fault, but it's unique, right? When we have data, we have the requirement and the responsibility, I think, to act on the data. So are we even interacting with our patients about linens? What was your thoughts on the linens? What did you think of these curtains? What did you think about the pillowcases? That's where value analysis can come into and create more of a patient centric approach. And that's something that we're trying to do from the AVAP arena is to put that patient back at the center of the value analysis process. Unfortunately, I'm not aware, I'm not saying it's not out there, but I'm not aware of any value analysis team right now that has an actual patient representative that sits on it permanently. And that's a delicate balance, right? Because you want somebody that's able to contribute to it in a way that's going to be impactful and also, collaborative. That all being said, the consumer, right, the person that pays the check is the patient in the bed, and they're not just a patient, they're a consumer of the services that we're there to provide, and in many choices they have they have the ability to go down the street, right, potentially to get care from somewhere else. And that's not always the case, but we have to think about what do we want to be known for. I want to be known for the highest quality, the most safety, right, the best outcomes, the best people, which requires good leadership, and also the most reliability to achieve the desired outcome that you as the patient have told me is most important to you. Because Lance may be different, Sarah may be different, I may be different in terms of what our desired outcome is. If you're 85 years old, your desired outcome may be I just want to get back to my home. But if you're 30, you may want to go right back to the gym and be lifting 400 pounds, right? It's about individualized care. And I think that is a little bit of the risk with AI. I love the use of artificial intelligence. And I think that frankly, it's going to be more and more in all of our fields, but you can never take the human out of the loop. Right. And it's not just us reviewing it, but more importantly, it's us thinking about is what we're putting out as the output going to actually achieve the goal of our individualized patient needs? Because every patient is different and every patient deserves safe, reliable, cost effective care. An ICU bill should not cost you $150,000 when, strategically, maybe we can get it down to 25,000. And I'm not saying that's always possible, but we've got lots of cost in healthcare that we can do better with. And that way people can have more accessibility to healthcare services as well, which is part of what, AVAP has done. Our whole mantra has been around the Institute for Healthcare Improvement, quintuple aim, and part of that is the provider experience, and part of that is health accessibility and equity. How do we ensure that folks can get access to the services that they most need? The only way you can achieve those is to make sure you take preventable cost and harm out of healthcare. And that's a passion that we both share.
Yes. I really wish I could just jump up and down and clap my hands right now because that's what I would be doing. And I know that a lot of people that are listening are going to be the same way. So I'm really excited about this. But I'm going to wrap it up with one last question here. What are the largest opportunities that you see with this partnership and bringing textiles into that value analysis conversation?
Well, so just where AVAP was several years ago, right? We didn't have a peer reviewed journal. Now we do. We didn't have, these formal position statements. Now we do. I think it's the same. How do we bring linen management, living services, everything that's part of that world to a conversation of evidence based medicine and practice? And, part of evidence based medicine is saying, we know this, we're somewhat confident in this, and we don't know this, right? It's almost three buckets. And, the we don't know bucket is honestly the most exciting for me, because that means that that's an area of research and further exploration. The area that we know well and we feel very confident in is where we start to push far and deep and across organizations, both horizontally and vertically, and say, here is the established best practice in the industry. Here is why it is. And why are we not doing it? Right? We have to ask ourselves the hard questions. And that's why AVAP is particularly excited to work closely with ALM, because we know that you, as not just an association, but frankly, as a group of passionate professionals, are deeply committed to that same thing. What we want to do is help bring it to a larger table, especially through publication and evidence based practice, which is more of that medical side of the house, because you already know the knowledge, you already know the best practice. We just want to make sure that we can get it out there together so that when contracts, evaluations, products are evaluated, right, there's some sort of standards out there that say, look within this bucket. Here's what you should be looking for, and here's how to objectively evaluate stuff. And also, frankly, to hold, industry accountable, because most of linen services, right, has some contractual relationship. We deal with that all the time in value analysis too. We want to hold our industry colleagues accountable to the expectations of safe, reliable care that we have as well. When we do that, here's the beauty. It's not about us. It's not about ALM. It's not about AVAP. It's about the patient in the bed that says, wow, this was an experience that was hard for me, right? Being inpatient or going through this healthcare experience. But I felt like the facility took extra care to protect me. And I think that's when we win, and that's when you sleep.
Agreed. This has been so incredible. I'm so excited. I'm ready for you to get off of come back from vacation so that we can get back to work, because I have missed our midnight chats this week, because you're right. We are always thinking and working, even sometimes at some extremely odd hours. But I love the energy that you have and the synergy that we create together. And I'm really looking forward to what this partnership is going to be for both of us and for our industry partners, as well as the patients at the bedside. So excited to have you here, and I look forward to working with you more and having you back on the show very soon.
Well, we are extremely honored to have the opportunity and frankly, the privilege to work closely with ALM and your leadership, and frankly, the patients, right, that we both are responsible for serving. So I think it's a right opportunity at the right time to make sure we achieve the desired outcome for our patients, which is perfect, right? Accessible, cost effective, safe, reliable care. And that's something we're both deeply committed to. So we're extremely excited. Thanks for the opportunity to be with you today.
Thanks so much. We'll see you soon. So, what today's conversation really reinforces is that we can't look at any one part of the system in isolation anymore. The decisions being made at the value analysis level directly impact what happens in healthcare operations every single day. To learn more about AVAP, I'm going to drop the link below so you can learn about the association and what it is that they do. And we look forward to seeing you again on our next episode.